A vehicle will come to our first screening site, which is manned by a number of nurses and people from WOMAC. So they will get screened there, answer a number of questions. Based on their answers, we are marking the windshields. So that will let our MPs that are helping to support us know which way they're directing those people based on their screening answers, and they will either be tested or put into quarantine or potentially just isolated without testing, depending on, again, their answers to those tests. Screening questions. So we have MPs that are directing them all along the way. Once they get here, we have more traffic people, again, wearing their safety belts to keep them safe as they're moving through our parking lot here at the fairgrounds. So they get directed to one of our testing sites. There, a number of things will happen. First of all, we have a scribe that will be collecting a number of pieces of information, data about those people, so that we can notify their chain of command and just for tracking purposes, make sure that their tests are being assigned to a provider so that we can have appropriate follow-up. So the scribes will collect that data, then we have a runner that will take that to our on-site laboratory folks who will print out a label for their samples. While that label is being printed, we have medics that will brief the patients on what is about to happen and the nasal flush that is going to be the way that we collect our samples. And then we have another medic that will actually be taking those samples. So once we get our label back, the patient verifies their information, we put that label on our sample, and then they're directed forward to another station where we have a final set of nurses who are answering any final questions those people have, giving them their memo for being in quarantine, as well as a number of different pieces of information from Public Health Department about COVID